Alright, I did my presentation on transthoracic echocardiography, and this is Gabe Meriwether. Alright, so a transthoracic echocardiograph is a primary non-invasive procedure that depicts cardiac anatomy, physiology, and function. This gives doctors key information about the heart using thin slice imaging. This information is such as the heart's ability to pump blood. It views any problems with valves or chambers of the heart and can identify any possible signs of a coming stroke and or heart attack. This also shows where poor blood flow may be, the heart size, and any injury to heart muscle. And with this device, doctors can then properly create an action plan for either prevention or treatment of any cardiac issues. So this is a picture right here of, on the left, of the device, and on the right is a picture of the actual echocardiograph. So this right here is the heart. Depicting here labels the right atrium and the left atrium, the ventricles. And so the physics. A transthoracic echocardiograph uses ultrasound waves to create an image of the thoracic cavity without any invasive procedure. The device runs on frequencies of about 1 million to 20 million hertz. In comparison, human auditory spectrum, so our hearing, is about 20 to 20,000 hertz. This is a really, really high frequency device. The wavelength and frequency of this device is related to the velocity of the ultrasound beam within the tissue. And so the picture on the right kind of depicts how the device works and kind of what it looks like, the probe, and using an electrical impulse into the organ or through the skin. And it says the sound waves are sent through a device called a transducer and are reflected off various structures of the heart. These echoes are converted into pictures of the heart that can be seen in a video monitor. So that's kind of the physics behind it. On the next slide, we have more physics. So basically, the transducer, which is this little picture right here, is sending really, really high frequency waves into a patient's body, usually the thoracic cavity. Obviously, you're looking at the heart, and these will bounce back from the organ, and the device will create an image to reflect what kind of waves the device is receiving back. And so right here we have the equation for ultrasound wavelength is just like a regular equation for wavelength. So it's lambda equals c, or the speed of light, over the frequency. And it's also shown here, wavelength is propagation speed divided by frequency for the ultrasound wavelength. So conditions of the test. A patient enters a room, they lie on their back and side on an examination table, and a doctor or a technician will come up and place a warm gel on the chest or parts of the abdominal wall and moves the transducer across the gel-covered areas. The patient has to breathe and exhale, varying how long they must hold their breath. While the patient is laying down and breathing, the transducer is picking up the echoes that reflect the heart. So this is what I was talking about with the waves coming back into the transducer, and the device basically creates an image from those waves. The procedure could take 45 minutes to an hour, but the test is painless, and the patient might feel a little pressure in their chest when the transducer is pressed against it. So the risk for this, since there's no radiation and it's not invasive, this doesn't pose any risk to the patient besides chest pain if they're really sensitive in their chest region, because there's slight pressure applied. But other than that, there really is no risk involved in the procedure. Okay, so the history behind echocardiography. The concept of this was first demonstrated by Lazzaro Spallanzani. He showed the reflected echoes of inaudible sound-enabled bats to navigate. So he was basically the founder of these echoes and these waves. But a Swedish physician, Inge Edler, was the father of echocardiography when he was the first of his profession to apply ultrasonic pulse echo imaging in diagnosing cardiac disease. So in 1953, he made the first echocardiographs using an industrial Firestone Sperry ultrasonic reflectoscope. But since then, there's been rapid development. There's various different kinds of these somewhat similar devices, and it goes from Doppler echocardiography to 2D into now the really advanced 3D echocardiography. And these images of the heart have continuously gotten way more vivid and specific and sharper and clearer. So changes to humans from this test. With the advancement of this echocardiograph, we've been able to catch things such as heart attacks or strokes before they occur, which has saved countless lives. Between 2000 and 2010, the volume of imaging services increased by 81% within Medicare, Medicare Payment Advisory Commission. That's the source. Physicians are increasingly using echocardiographs, and as shown in this graph right here, there's a pretty general trend upwards. There has been some issues in this with the quality of the echocardiographs, and there is some issues with physicians having to keep up with the technology. As the technology advances rapidly, physicians are needing to know more and learn more about this device, which is one issue for it, but it's also good that these patients are receiving more clear diagnosis about their heart condition. And these are my sources. Thank you for the presentation, and thanks for listening.